Hello, everyone. Thank you, everyone, for joining us today, and welcome everyone to this webinar entitled Understanding Research for Impact. My name is Debbie, and I am the Operations Manager for the Tasmanian Collaboration for Health Improvement. I would like to acknowledge the traditional owners of Lutruwita, Tasmania, the Aboriginal people, and their continual survival and connection with their land, sea and sky country that spans millennia. And I pay my respects to elders past and present, and I also extend a warm welcome to anyone from the Aboriginal community who have joined us today. This webinar is the first in a series of events planned for this year, delivered through the Tasmanian Collaboration for Health Improvement with our partners. This series is intended to be a foundational information series to support you in your research. The collaboration is a recognised NHMRC Emerging Research Translation Centre and was established by our partners in 2018. Our partners are the State Government Department of Health, Primary Health Tasmania, Health Consumers Tasmania and the University of Tasmania. As a research translation centre, we aim to increase and accelerate research into practice for improved health outcomes. We do this working with and offering support to our research community in three main ways: supporting collaborative translational research for research translation projects, supporting people through capability and capacity building opportunities like today, and enabling research by identifying with the research community what would support and enable translational research to occur. Just some housekeeping before we commence. You will have noticed that we are recording the session today. This is so that we can make this recording available through the TCHI website and also to share with those participants who are unable to join us. Microphones have been switched off during this webinar, and we ask that you ensure that they remain switched off. We do encourage questions, and we encourage you to use the chat function at any time. The questions and answers session will be facilitated at the end of all the presentations by Kerry Turnbull, who is our Consumer and Community Coordinator for the collaboration. I'm pleased to introduce Jo McEvoy, who is the Research Services Manager, University of Tasmania, Verity Cleland, Associate Professor, Menzies Institute for Medical Research, Siobhan Harpur, Director Strategy and Engagement for the Tasmanian Collaboration for Health Improvement. I would also like to take this time to thank and acknowledge the contribution of the University of Tasmania, the College of Health and Medicine and the Menzies Institute for Medical Research for their contribution to planning, organising and promoting today's event. So let's get started. To quote the NHMRC, the creation of knowledge does not of itself lead to widespread implementation and positive impacts on health. The knowledge must be translated into changes in practice and policy for the benefits to and impacts to flow to Australians. So just to outline what we will be exploring today, Jo, Siobhan and Verity will talk about what is research impact, funding applications and research impact, and how to have research impact. The final 10 minutes will be a questions and answer session, and we encourage you to get involved. Now over to Verity.
Thank you. Thanks so much, Debbie. Thank you to the Collaboration for Health Improvement for hosting this session today, and thank you for the really kind invitation to be part of this panel with Siobhan and Jo. For those online who don't know me, and I don't know, my name's Verity Cleland. I'm, as Debbie said, an Associate Professor at the Menzies Institute for Medical Research. I lead a research program in physical activity and public health, but I'm really broadly interested in research translation. And I think this really stems from my background in health promotion before coming to academia. So when I did switch to academia, I have always been really interested in what does our research tell people who are working in policy and practice. It's something that's always been on my mind. So while I wouldn't consider myself an expert in research impact, it's something that I'm really passionate about, and I've been involved in many research projects now that have created deliberate strategies to try and maximise the likelihood of the research having impact. Right. So I wanted to start off by getting everyone here to have a bit of a think about why we might want our research to have impact. So before starting to talk about what is research impact and how we might do it, I want us to think about why we would want our research to have impact. And I'm going to do this through an interactive activity. Some of you will have done this before in online seminars. We call it a word cascade or a word waterfall, as per the beautiful photograph there. What I'd like you to do in just one or two words, a couple of words, no more than a sentence, jump in the chat and let me know. Don't hit send just yet, but let me know why you think it's a good idea for our research to have impact. I'll count you down in a moment. I'll say 3, 2, 1, go, and then hit send. But don't hit send until I say. And what we'll get is a lovely stream of words coming down through our chat. So this really relies on everyone engaging and everyone popping some words in the chat. So I'll just give you a moment to type your words. Don't overthink this. Just pop the first few things that come into your mind into the chat. Don't press the send button just yet. Nearly need some thinking music here, but we might get going. So when I say go, hit that send button. So I'm going to say 3, 2, 1, go. Oh my goodness. This is coming through thick and fast. Wow, that's amazing, everyone. Thank you so much. I'm seeing all sorts of things here: adding value, accountability, creating change, influencing practice. That's about patience, real people. Yeah, this is fantastic. And I think so many of these things will be covered in today's session, either by myself or Joe or Siobhan. So thank you, everyone, for engaging in that activity. But I think it would be great, Debbie, if we can record those comments somewhere and share later. Okay, so why does research impact matter? I think if we're taking a really, a broad, big picture perspective on this, a focus on impact really helps us to ensure the best possible return on investment that has been made by us as a society in research. So most people will know that research money doesn't grow on trees. It's funded by government organisations, non-government organisations, charitable organisations, philanthropists and industry. And we are really accountable to those organisations that are investing in us. So focusing on research impact really does to help ensure that people are getting that value for money. I think the other reason that impact is really important is because it helps us to keep focused on the overall purpose of the research rather than the process itself. And what I mean by that is it can sometimes be really easy to get caught up in the research process, in writing papers, in getting the next grant, in going down rabbit holes. Our research always raises questions, and we can get really caught up in that, caught up in our methods, in our projects. And so thinking about impact really keeps us thinking about the overall purpose of that research rather than the specific processes. And I think that's really important. So what are the benefits of research impact? I won't dwell too long on this. I think a lot of people have in the chat made some great comments there. But as I touched on before, there's some, there's a greater good element of this. We can develop new solutions. We can do some capacity building. We want to make the world a better place, and a lot of us have an intrinsic motivation to do that. In terms of our research, thinking about impact can help us to think about new ways of communicating our research to the people who use the findings, whether that's the community and consumers, policymakers, clinicians, health services. It can also help us to either focus or diversify our research by taking on board end user feedback. If we're not putting our research out into the world and getting that feedback, we may go down rabbit holes that perhaps lead us away from where we should really be focusing. And it also enables increased opportunities for testing or translation of research in practical and real life settings. Oops. Went too far. And, you know, for many researchers are busy people, and there may be people out there thinking, why should I bother with research impact? Can I not just get on with my research? Perhaps there's some personal opportunities that might appeal to those. So, you know, thinking about research impact can help to increase personal influence through collaborations, for example. It can help to build strong and trusted relationships outside of academia. It can give us enhanced credibility as well and enhanced reputation, and all of these things can, you know, generate their own benefits. For example, you know, being invited to be a member of an advisory committee or a prestigious panel, for example. In terms of funding, research impact can really raise the awareness of the importance of committing those public funds to support research if we're showing that it is a good investment in the money that's being spent on research. And it can also raise awareness of or even grant access to different funding sources or opportunities, a really important one to keep in mind. So what actually is research impact? Jo's going to provide some definitions that come from the Australian Research Council, National Health and Medical Research Council and the Medical Research Future Fund and others. So I won't spend too much time on this. But the definition that I like is this real change in the real world. I mean, this is a really simple message and a really simple definition. And I think that's why it appeals to me. We want our research to have impacts that create real changes in the real world. I want to briefly touch on the difference between impact versus routes to impact. So impact is something that other people or institutions gain or do. It isn't something that you as a researcher can do, but you can certainly encourage it through research impact activities. What is not impact are things like giving evidence to a select committee, working with a business, or contributing to an exhibition in a museum. Those things are not impact in and of themselves, but they can become impact if the people or organisations involved somehow do or experience or understand things differently as a result of their interaction with the research. So giving that evidence to a select committee, not impact, but that select committee refers to your evidence in their report, that would be impact. So just a slight nuance there, but I think it's useful to think about. There are many barriers to impact. It's not easy. Some of this is related to the way that the research world has historically been undertaken or funded, communicated and evaluated. So some of these barriers are, you know, long-standing and historical, but many actions have been put in place now, I think, to try and break down some of those barriers that perhaps were in place in the past. Another barrier is the impacts are really hard to quantify. They're very hard to count. They can be hard to see. So in trying to explain research impacts, that poses a really big challenge. Many people here today would be aware of the considerable time lags between research and impact, and we often talk about that 17-year time lag from discovery to real world. Sometimes it's longer than that. So everyone is very conscious of that. So impact can be really difficult to have in terms of a time lag. Impact can be temporary or long lasting. You might do some research, someone sees that research and designs a program or implements a policy based on that, but perhaps that only occurs for a short period of time. The program finishes, the policy is updated. So how do you count that and how do you capture that? Another tricky factor to navigate is that impact is often from an accumulated body of knowledge and research, and often not related to one specific research finding, so one paper or one project. It often comes from a field of research done over many years. So again, attribution can be really difficult there. But what are the things that might facilitate the use of evidence in practice? This comes from a systematic review, which is a little bit old now, but I think were this updated today, we'd probably see the same or similar findings. The top 5 facilitators of use of evidence by policymakers, so this doesn't apply to every field, were availability and access to research or improved dissemination, collaboration, the clarity, relevance and reliability of the findings, relationships with policymakers and relationships with researchers or staff. Now, I think what's really important to notice here is that 2 of these are really about how we communicate and disseminate our research findings. And the other 3 are really about relationships and collaboration. So again, a really good reminder that what we do and who we work with can be just as important as the research itself in terms of having an impact. There are a number of practices that we can undertake that can support impact, and this is not exhaustive, and doing all of these may not necessarily lead directly to research impact, but I think they are likely to increase our chances of having some impact. So as mentioned in the previous slide, using our networks and relationships with our research users is really important. Acknowledging the expertise and active roles that end users, so when I talk about end users, I'm talking again about communities, policymakers, practitioners, clinicians, really acknowledging that they have a really important role to play in making impact happen and seeing us as partners rather than an expert giving information to an end user. As I guess that related to that is the idea of involving end users at all stages of the research. So I think here we're really touching on co-design and co-production, having flexible knowledge exchange strategies, and developing good understanding of the context, policy and practice context, where your research may be used is important. Clearly, we want to commit to portfolios of research activity that build up a strong reputation with research users. We want excellent infrastructure, leadership and management support. For some people, involving intermediaries and knowledge brokers can be really useful. And it can also be useful to support space and time for collaborative reflection. And what I mean by that is perhaps sitting down with partners and collaborators and just having a think over your project. You know, what worked well, what didn't, what could we do differently, what could we do to improve next time, can be a really useful process. So what does impact look like? This is my last couple of slides before I hand on to Jo. I just wanted to share a few local stories. So these are not my stories. I'm sharing them with the permission of the relevant people involved that I'll acknowledge shortly. And I won't spend a lot of time on these, but if you are interested, do feel free to reach out either to myself or the researchers to talk more about it. But what I've tried to do here is I guess provide a range of different examples of what impact can look like. So Professor Faye Johnson and her team work in the do a lot of work in the air quality space, and particularly in and around bushfires. And a couple of years ago developed a short online course, a MOOC, massive open online course, called Bushfires and Your Health. And this is based on years of research into the impacts of bushfires on in particular respiratory health, but other aspects of health as well. This free course over the last couple of years, so 2021 to 2024, has had over 1,000 enrolments from all states and territories in Australia, plus international enrolments, and a 32% completion rate, which I'm told is 4 to 5 times the average completion rate for these sorts of courses. There was also evidence, and this has been published by Sharon Campbell and the team, to show that the course increased bushfire knowledge, instigated new actions like downloading and using an air quality app, developing a survival plan and making household preparations. So direct impact on the behaviour of people who had completed the course. Another story, impact story, comes from Professor James Sharman and his team who work in the blood pressure space. Jim's team are really interested in how we can accurately measure blood pressure. Clearly, that's important for accurate diagnosis. And their work has been adopted into regulatory policy by the PAHO, which I think I'm going to get this right, the Pan American Heart Organization, who now state that only validated blood pressure devices can be marketed in the Americas. And this policy has been implemented across 32 countries, which is nearly 3,000 healthcare centres and more than 30 million people likely impacted by this. There's also been policy changes that have enabled countries in the Americas to access a strategic fund to purchase validated blood pressure devices to ensure that accurate measurement. And this fund was not accessible in the past for this reason. The team have also developed a range of online documents and resources and online certificate courses. These have been translated into many different languages, are endorsed by international health bodies, and are used around the world by healthcare workers and community members. So a slightly different example of impact there. And finally, I guess coming back more locally, Dr. Kim Jose has been leading some work over the last few years in and around how families are engaging with early childhood services and how health and education services can work together to support vulnerable families in our communities. And this has been done in and around 12, I think, at the time, child and family learning centres across Tasmania. And the key recommendations for that project have now been reflected in Tasmania Department of Education practice and reporting requirements. It's been reflected in the collection of data on the participation of male caregivers in centre programs, which prior to the research had been overlooked. There's been strengthening of connections, documented strengthening of connections between the centres and schools, which is really important. And one of the key findings was around formalising outreach strategies, and the need to do that has now been recognised. There's also been a key action in the Tasmanian Child and Youth Wellbeing Strategy that's been directly informed by this work. And nationally, outreach has been given priority through strategies and recommendations in a number of documents and spaces. So hopefully those three examples showcase some of the great research that happens here at the Menzies Institute and gives you a sense of how different research impacts can look. I'm going to finish there and pass over to my colleague, Jo McEvoy. Thank you.
Thanks, Verity. So my name is Jo McEvoy. I'm the Research Services Manager for the College of Health and Medicine Research Hub. So this little schematic down the bottom is basically a representation of the research journey, if you like. And the university has a number of teams along this process to support researchers in the journey. So my team actually operates in the really early phase of this journey, the project conception, orange and yellow icons there. And my team is focused on supporting researchers to find and apply for funding. Where we may expect to see research impact is right at the end of that journey, sort of more towards the green circles or green icons at the end there. So you might ask, why am I, from the team that supports work right at the beginning of the process, talking to you about impact? If we have a look at the project conception kind of icons in a little bit more detail, you'll see that even though we may not be expecting to see research impact until right at the very end of the journey, you actually have to be thinking about it and planning for impact right at the start. Every type of research has the potential to have impact, and it's important to consider what your potential impact will be, as it will influence how the project is designed, what might be required, and who is involved. As Verity said as well, keeping in mind the intended impact of the research helps to keep us focused on the overall purpose of the research. What we're also seeing is increasingly when you apply for funding, funding bodies expect you to be talking about the research impact and that impact pathway within the grant application. So most funding now comes with requirements around achieving and demonstrating research impact or the potential for research impact and being able to articulate that in your funding application stage. Most funding bodies define research impact. What I've got on the slide is some overarching definitions, some broad definitions of research impact, and the expectations around impact may be further defined within specific funding guidelines as well. So the examples I have up here are all large-scale federal or national funders. We've got the National Institutes of Health in the US, the National Science Foundation, Research England, and then down the bottom I've got the Australian Research Council, the National Health and Medical Research Council, and the Medical Research Future Fund. So although these are all large-scale federal funders, we're also seeing at the more local level that local research funding organisations also have expectations around impact. So, for example, one of the Royal Hobart Hospital Research Foundation's guiding principles is to support research that demonstrates the potential for tangible and measurable benefits arising from the proposed work. This can include publications, patents, or a health service delivery outcome, so translation into clinical practice improvement, or a demonstrated major impact on policy development. The Heart Foundation looks to invest in high-impact cardiovascular research, research that is likely to see results and provide significant change. So from a funder's point of view, organisations have limited funding. They want to ensure that the funding is well spent, that there's return on investment, and that they, via your research, are making a difference. Many funders now report on and evaluate the impact that their funding has had, and they have frameworks in place on how to assess and evaluate their funding impact. So NHMRC, for example, has developed an impact position statement, which can be found on the NHMRC website, which is used to help describe the role that NHMRC has within the broader health innovation system in generating research impact. And it defines that NHMRC aims to foster, promote, and evaluate impact of the health and medical research that it funds. NHMRC produces impact case studies to demonstrate the contribution that the provision of NHMRC funding has had, and you can access these all on the NHMRC website, and they make for some really interesting reading. The Medical Research Future Fund notes that understanding the impact of the MRF funding is critical to understanding whether the MRFF is actually meeting its stated objective to improve the health and wellbeing of Australians. So they've developed a monitoring, evaluation and learning strategy to provide a framework on how to assess the performance of the MRFF against its 5 impact measures, which are listed on the bottom of the slide. And in grant applications, you have to articulate how your project will contribute to these measures of success. As a slight caveat, but I think it's important, impact can also arise out of what we sometimes see as a negative result. So, for example, the NHMRC specifically states that research impact can include a decision not to use a particular diagnostic treatment or policy. So how is impact considered in grant applications? So while it's important and it's increasingly, we're seeing the requirement to address impact in grant applications, as Verity touched on, measuring impact is really difficult and it comes with challenges. Impact is a longer term measure. It's been estimated that it can take 17 years for research to feed into clinical practice, for example. And there's also that attribution challenge. So the link between research and its impact is not always linear. So while you need to include impact in many of your grant applications, it's not necessarily easy to do. The key thing is to know your funder. So some funders will have specific questions or sections within the grant application on impact. Some will expect you to cover it more broadly within the project description. Some will ask only about the intended impact of this project. Some will ask about the impact you've had with previous research as a way to demonstrate that you have that follow through, if you like, that you can have create impact from your work. Some will be asking about the impact pathway. In general, consider what your intended impact is. So who might benefit and how might they benefit? What is your impact pathway? How will you engage? What is appropriate? What will you do? And do you have the required skills, expertise and resources? Most funders now that I'm aware of will include impact as part of the assessment criteria for the grant as well. And so you should be aware of how the assessment criteria is defined, as well as any other supporting information that may apply for that funder. So for example, the MRFF Cardiovascular Health Grant opportunity has an assessment criteria of project impact, which is worth 40% of the overall score. Within the grant guidelines, they provide a description of the specific impact assessment criteria, but then they also make reference to the intended objectives and outcomes of the grant opportunity, which is defined elsewhere in the grant guidelines, as well as to how the project will contribute to the goal, mission and aim of the overall funding scheme, which is set out in the Cardiovascular Mission Roadmap and Implementation Plan, which is again a completely separate document to the grant guidelines. Within the proposal itself, you have 3 pages of the grant proposal to talk about the impact, as well as a separate section on how your project will contribute to the MRFF measures of success, and that's a 1-page answer. So in your response to the project impact criteria, you should be considering things like how will you progress the research area and how your project outcomes will contribute to meaningful advances in health outcomes, practice or policy. Demonstrate the involvement of consumers, partners, end users, and how their needs and views have informed the conceptualisation and development of the research and its planned translation and implementation. There may be further considerations if you're focusing on an MRFF-defined priority population or topic. As another example, the Heart Foundation's Vanguard grant has an assessment criteria called the potential for outcomes, which is actually worth 70% of the overall score. So the proposal should describe the tangible outcomes with the potential to improve cardiovascular health, and reviewers are instructed to consider how the project will affect the heart health of Australians. Reviewers are also advised that in order to get the full understanding of the team's potential or experience, they should consider the project overview section, the research environment, the team track record, as well as the expected outcomes of the project sections of the application. So they're asking, do you have the skills base that support the environment and the team to achieve the intended outcomes and therefore have impact from the work? So not just what your intended outcomes or impact of the project is, but can you reassure reviewers that you have the skills and support to ensure that this impact is realised? So while there's a very clear assessment criterion around impact, how you address it is probably much more dispersed throughout the application than compared to the MRFF example. So these are just 2 examples of how impact might be considered in grant applications, and I'd suggest that probably every grant is going to be slightly different. Impact is likely to be a component of grant applications though, and as you can see, it can be weighted really heavily in the assessment of the applications. And I hand over to Siobhan to talk to you a little bit more about the impact pathway.
Thanks very much, Jo. So lucky last, I'm Siobhan Harpur, and you've already heard a bit about the collaboration at the outset of the session from Debbie. I'm the Director of Strategy and Engagement. My research background or interests are as a political scientist interested in systems change. So, you know, the impact story is a tricky one to tell. And I think it's important just to start with something which will sound a little bit like it's already been said, but it can't be understated, that we have this paradox of, on the one hand, needing to be very clear that we're setting out on an intention to have impact. We're setting out to describe that, but it's also true to say that the understanding of the impact of translational research is often indirect, and it's very difficult for us to make those clear attributions because there are so many things happening when we're implementing things into practice, complex interactions, unintended, unplanned, things that happen in collaboration and process that are very hard for us to say that was as a consequence deliberately of the research that we undertook. It's also very important for us to acknowledge that evaluating research impact is still very much an evolving field, and there is no single gold standard method. And many of our evaluations just simply don't, the methods and approaches just simply don't capture the multifaceted, complex things that are occurring, and especially the longer term benefits, you know, that we'll often hear about some years after a particular research project has happened, and of course claim attribution, whether or not we can clearly or distinctly do that. So I'd like for us to understand a little bit more about some of the things that have already been raised by both Jo and Verity. The impact position statement that Jo referred to on the NHMRC website talks about this pathway to impact. And you've heard us talk about measuring probably more in terms of the mid-range on this pathway, because what we're talking about is an intentional long-term goal, which is societal, economic, and so on. But what we're probably going to be able to specifically measure in any kind of attributable way is somewhere along this pathway. It's going to be somewhere in the outcome range of this journey. And it is a journey, and it's deliberately put in this arrow so that we can show that pathway of intention. These points that, I mean, this is one of my doodly drawings that I love to do, those of you who know me. But if you look at those words across the bottom of the pathway, you'll see those reappear again as I describe this sense making a little bit more in the next slide. So you see those same sections of the pathway across the top. And what falls beneath this is a program logic approach. Now, you might have noticed in the slide that Jo had in describing the impact as it needs to be reported into our applications for funding. That was also a program logic model with inputs and impact at the far end. And even if we don't complete a complete plan of a program logic approach, it's a really good way for us to understand how it is we're setting out with our research project to achieve the real world change that we want to see. So if you look at that outcomes early impact panel, this is really the things that we're aiming to achieve with our research project when we talk about research into impact research with impact. We're looking at, are we translating evidence into practice? Are we creating end user artifacts? Are we looking to actually change the culture within the organisations that we're working in? Is it a service innovation? Is it a systems change? Are we informing decision making? Are we advancing knowledge? Are we looking to leverage new funding, or are we making policy change? We may be making seeking to make a combination of these things, but you know, we're often focused on one in particular, and that will influence the longer term impacts that we'll be claiming we're moving towards, whether they're health improvement outcomes or social or economic outcomes, but it also informs coming back down the chain to what are the planned interventions that we're going to do in our research project. What is it in terms of activity and output that we'll be undertaking? And these are really some of the conceptual things that we would want to be including in thinking through our implementation. How are we going to involve the research team? Who is the research team? Does that include, in terms of end users, does it include health and community practitioners? Does it include researchers in other disciplines or maybe even in other universities? Does it include consumers and community members? How will we collaborate with them and with the partner organisations? How will we build the capacity of the research team or the people we're working with within an intervention to get that embedded into practice if that's what we're doing? And how will we reflect on what we're doing as we're implementing the research that we're undertaking? And stepping back to the very beginning, of course, this also influences the initiation of the project. Who do we need to engage with? Who do we need to already either have a relationship with or establish a relationship with? Because some of that's going to have to go into our not only our design, but absolutely into our application for funding. And what's the governance arrangement we're going to design and establish for this project? Will there be place-based advisory or implementation groups? Will there be a whole of state guiding group? How will the research members, particularly if you've got end users involved, be involved in that governance? And how will you talk to each other, and what's the frequency of meeting and so on? So that's a bit of the sense making. In terms of planning for impact, well, there are common component parts to your impact planning for consideration. And these, we found this toolkit that's been developed by the University of Western Australia, and think it's actually a very useful guide and resource. This is just a screenshot, but you can hyperlink on any of these icons, and what sits behind them is some guidance for and ideas of things that you might want to consider including. There are some templates, for example, that you could use to jot down your thoughts and ideas for how you will plan to meet that particular area of the plan for impact. And all of this is useful to do in preparation when you know, for example, MRRF has 40% weighting for that impact, for the impact of your research project. It's really important that you've given thought to this from the outset. And then I'm coming back here to the research snake diagram that Jo put up, and this is the tail end of that diagram, but reworked in terms of us thinking about how do we report on impact? How do we measure the impact that we hope our research is having, bearing in mind we're talking about those early outputs and outcomes rather than long-term impact, how we evaluate it, and what might be our next steps. So in terms of these first two icons on the left, the strategy measures and the performance data, we inevitably, particularly when we're doing translational research and research translation, have a mixed method approach to the data that we collect. There'll be some things which we can literally count, and that's always useful and helpful, but it only gives us some point in time measures and some of the picture of the impact of what we're doing. So those performance data number counts, if you like, are, you know, who we've involved, how many, where were they from, what their backgrounds were, what people's experience, expertise is, and so on. Attendance at events. We might be looking at, if we're putting the resources up online, for example, we might be looking at web hits and click-throughs, publications, presentations. There may be the actual activity. In terms of outputs and supervision, there might be students, PhD students, or supervision of things into practice, and there may be accreditation involved. In terms of those more strategy measures, which are often the more qualitative types of data that we collect, there'll be a whole range of different things. There may be interviews, testimonials, briefings. Those might be policy briefings. They might be briefings within the area of clinical or community practice. There might be awareness surveys you might do before and after an intervention. Who's involved? How are they involved? Consumers, industry, and there may be things that we produce like evidence synthesis and interested to see whether people find that useful, helpful, they're applying it into their practice. Communication is inevitably a major part of what we're doing, and I think, you know, Verity attested to that at the start of this session today. We are really, probably most importantly, wanting to talk often in plain language about what it is we're trying to do with as many people as possible who will listen and be interested as part of the process of change itself. There's the theory of change that might underpin what it is we're trying to do. We've talked about the impact pathway, and then there will be the different project outputs as a result of the research that can be communicated in a whole range of different ways. One of the things I know in my previous work as the CEO of Public Health, we used to really appreciate collateral in terms of briefings that gave short snapshots of things that had occurred during research projects, because it was often a very valuable way of being able to communicate to our own stakeholders the progress that was being made with a particular change initiative or a particular research project. Webinars, seminars, workshops, listening to stories, using different methods for stories as well. They might be art-based, textual, oral, and of course web and social media. When it comes to really then telling that story, there's formal and informal evaluation, but evaluation is something that is a critical part of what we do even at the informal level. It's the opportunity to reflect and review what it is we've undertaken. Verity talked about reflective collaboration. So evaluation may literally take the form of getting the research team together and saying, how did we think we did? But we'll also be highly likely to be needing to review our performance and our measures of what we've done and the significance or the reach or the attribution of what we've done in order to refer back to our funding partners and our stakeholders and the people who've been involved and the people who are the end users of the research project we've undertaken. So we want to do that in order to analyse how we've done things well, what we've learned, the mistakes that we've inevitably made, and how we might do something different if we have another opportunity, or there's another environment, or we scale. But we're also looking for where we can demonstrate that attribution. And in terms of next steps, of course, there's the reporting, there's fostering relationships, because these projects give us so much opportunity to establish new relationships and fostering them going forwards, whether or not there's ongoing research funding, is often a great opportunity for continuing to learn. There'll be outstanding questions and opportunities, and there may be a rationale for new research ideas, which of course take us right back to the beginning of the cycle, again in seeking support and funding. So that's it from the three of us. I'm going to hand you back now to, I'm actually going to hand you to Kerry Turnbull, who's been tracking, I hope, questions in the chat as we go, and then I'll be handing you back to Debbie to close us off. But Kerry, if I could hand to you first of all.
Thanks so much, Siobhan, Verity and Jo. So everyone, please go ahead and pop your questions in the chat there for us. But I'd like to start out with a question or a comment that could go to Siobhan, Jo or Verity. So Siobhan, you might like to take it first. The comment was around research impact and evaluation should feed back into the next project idea and grant. Otherwise, the lessons and the knowledge is lost, which very much links into your concluding statements there, and also the consideration around, obviously, continued funding. Perhaps you'd like to field that one in the first instance, Siobhan.
Yeah, I think this is really important, and regardless of whether or not it feeds into another cycle of research, it's such a critical point for us to consider that impact pathway when there is a research project that has been funded, to consider what it is we've learned from this, where has it taken us, where can it take us beyond this, and it also then creates the opportunities for where there might be another research funding opportunity 2 or 3 years down the track. And sometimes if we haven't taken the time to really reflect and feed into that cycle, we may not be able to pick up those opportunities when they arise in the same way. I don't know whether Verity or Jo have anything to add. No? Okay.
Okay, thanks everyone. As I said, please go ahead and pop your questions in the chat, because we've got a great opportunity to ask our hosts questions there. So I'll pop one in from myself. I was really interested to particularly hear, Jo, and around your perspectives in terms of having that impact right at the beginning when you're putting in your grant applications and funding. Perhaps you could talk to us just a little bit around some of the things or the items that researchers can put in their applications that start to actually demonstrate that. What are some of the things perhaps that those funders are looking for, particularly in their applications? Really, again, you highlighted it at a high level, but some of those more specific areas where researchers have the opportunity to demonstrate that impact.
Yeah, so I think what we kind of see most is things around consumer and community involvement and involvement of end users, how they've been consulted or brought in at the conceptualisation stage in terms of how the project has been designed, what their involvement is all the way through. Have they been a part of informing the research questions and topics, and then how those people or end users might be involved throughout the process? Is there going to be a series of kind of feedback or cyclic mechanisms to make sure that the project is progressing in a way that is valuable to end users? And then the other thing that we see articulated is dissemination plans for the research. So how are you going to get your research outcomes out there? How are you going to communicate that to the wider community, to the public, to industry, to end users? So those are two things that we see quite often, I guess, in grant applications, and that funders look for as well.
Fantastic, thank you. Yes, there's a really interesting to see some of those tangible ways in which, you can actually demonstrate that within a project. So then just in terms of a question for you, Verity, while we're waiting for everyone to pop their questions in, please keep them coming. I was really interested on that comment that you made, particularly around that, just that slight nuance between, having done the research and having some outcomes, and the difference between when it actually becomes impact. So some of those things that we can actually see, then we really have made an impact. And so that might then actually be a change in practice. I'd be interested if you could just unpack that a little bit more and consider some of those other ways where we can really show where I think it's probably from a research perspective, you're very focused on the research, but really kind of then thinking right to that end is how have we made that change, and then how are we going to go about measuring it? Because that's where the evaluation piece obviously can start to come in, because we can see there's some changes in something, whether it's practice or downloading a new app. So I think there were some great examples.
Yeah, thanks, Kerry. It is a really interesting one, and I think sometimes we don't spend the time thinking about the difference between the pathway to impact, or the route to impact, I think was the term I used, and the impact itself. I think, a good way to think about it is that the route to impact, it is really the things that we as researchers are in control of. And the impact is something that, I think in one of my slides I talked about, it's something that others do. It's something you don't actually have a lot of control over. And that's another one of the challenges and I guess the barriers. You could be sitting in front of as many select committees as you can and distributing, doing all the things, but you actually can't, you don't have the control over the end users, who are the ones that ultimately are the ones that have to make the change or implement the policy or design the program. So it's a really tricky one, and it can be really frustrating for researchers, because you think, well, I'm doing all these things, I'm spending all this time on these activities, and perhaps not seeing any benefit from it. I guess, in terms of funding applications and things, this is where we do talk about, these are the things we have control over, and we hope that something will change. It is our goal. I guess the other layer that bring in there is, I talked a little bit about the facilitators of the uptake, and a couple of those being key were communication and collaboration. So I know we've spoken a fair bit about this today, but really nurturing and building those relationships, I think, together with those activities can perhaps increase the likelihood that our research will have impact. Turning up at the end of a research project and saying to someone, here you go, here's my work, it's probably going to fall on deaf ears. So I think, just as good practice, we're building relationships and investing that time in perhaps what was traditionally seen as sort of soft infrastructure, communication, networks, collaboration, absolutely critical, I think, for research impact. Did anyone want to add anything?
Look, I think that's it sits, what you said, Verity, sits obviously very strongly with what Jo has told us. Certainly the large scale funders are looking for, that they've shifted a great deal in really asking for the evidence and the expertise up front, that we are doing that involvement all the way through the research projects of our end users. And, our experience from the collaboration, what we hear, particularly probably from clinicians and people in policy and practice, is that's the bit that's most important. People don't want research done to them. They don't want evidence brought into practice that might be great and important evidence, but if it's not done contextually and with those end users from the outset, it's probably not going to be sustained. And it may not even successfully get traction. And then that takes us right back to the beginning of the points that Verity made at the outset, which is that it's not just that we're personally intrinsically driven to make a difference, but that, you know, the research that's funded with public money should have real world change, and that real world change will only come if all of us are involved in the process, using the expertise of researchers, but also with equal value, using the expertise of the end users, the practitioners, the consumers and community members to guide something really into having effective impact.
Fantastic, thank you. And I'm just seeing whether or not I've got anyone here. Thank you. We've got a question for the panel members. With these increasing expectations to involve consumers and communities in research, should we be this is an interesting one. Should we be concerned about exhausting the same few consumers with research engagements, particularly consumers from equity groups? So great question, and it does come up particularly in the consumer and community involvement space. So yeah, I think that one certainly to any of the panel who'd like to comment on that, and particularly around research with and by consumers, and the fact that there are also perhaps that opportunity there for people to maybe be, you know, feeling like they're always being tapped on the shoulder.
I'm happy to look, Maria. I think it's a fabulous question, and I think it's something we probably need to think about a little bit more as we do more and more of this type of research, and be cognizant of it, you know, in our individual practices. But sometimes some central coordination can really help with that. And I know Kerry, through her role with the collaboration, and we have Dimmy at the Menzies Institute who helps with our consumer involvement, you know, working together to ensure that we try and avoid that where possible. I know, Maria, even in your work, you know, where you've engaged, people have actually been really excited to have a voice, and that suggested to me that in that particular area, people living with a disability, that perhaps that wasn't an issue yet, but in the future it certainly could be, and there perhaps are some other groups where it is an issue already. Yeah, I'm not sure if I have any other great words of wisdom on where to say, but we need to be mindful of it.
We do, and it's clearly a growing area of interest nationally, and we know that from the collaboration, and, you know, obviously having Kerry, yourself as the consumer and community involvement coordinator, there is a huge range of understanding, as well as so much appetite and interest to involve consumers and community members in research. So I think it's beholden on all of us to look for opportunities for people to be respectfully engaged and trained and enabled to participate, so we don't end up cycling the same people through, or taking advantage of people's generosity to be involved. And the more people who are involved, and the more people who are trained and understand how to apply their own expertise from their experience, well, the better outcomes and the better impact our research will have for the longer term. So I think it's a critical area of work, and one which is gaining more and more momentum, and we certainly want to involve more consumers and more community members in the process.
Thank you, everyone. Great comments there. Yeah, great question. I've also got a comment here it's a huge issue within the social research sector as well. So not confined to health and medical research in particular, but obviously across the board in other areas of research as well. Again, please keep questions coming, because I think we've got a little bit more time for the chat. How we go? Yep.
Actually, no, we're at time.
We're a little bit over time now.
Okay. Yep. All right.
We might wrap up.
I might wrap up. I just want to say thank you for everybody who has posed a question, and also for Kerry for facilitating that session for us. Just this slide, I'd just like to say that please click through on the QR code and sign up to become a member of TCHI if you haven't already. And also you can find us on LinkedIn, and you're very welcome to follow us. Also, there were a number of resources mentioned today. They are actually available in the Tasmanian Collaboration for Health Improvement website in our resource library, and we will send you a follow-up email to let you know where that is, but also where the recording is available, and that will probably be next week. I would like to wrap up, and I had a bit of a longer wrap up, but I just want to say that the really big standouts for me was the quote that, you know, research impact is real change in the real world. And to achieve that, the really important messages that I was hearing throughout this discussion around the importance of communication and communicating in ways to meet audience needs, but also the importance of collaborating with the people that will be on the receiving end of the findings of that research. I think that are really standout messages for me. And without further ado, I would just like to say thank you for everybody who has joined us today during their lunchtime, and especially thank Verity, Jo, Siobhan and Carrie for this webinar. And I will now bring this webinar to a close. Have a great day, everybody.
Debbie.